Hello, I'm Dr. George Ampat. I work as an orthopedic consultant in Liverpool. I'm also a clinical teacher in the School of Medicine. Reflecting is something that a lot of doctors can struggle with. It can feel unnatural, it can feel forced, and it can make us feel very vulnerable. I know on a personal level that in difficult situations, it can make us doubt ourselves and our ability. Being asked to write down a written reflection of a situation that has gone wrong can be even more difficult. Documenting on paper seems to make it more permanent, and we always worry that others who may not be concerned with the event may read our reflection and then judge us negatively. It is natural to feel that we have to put up a defense. Unfortunately, if we do not reflect and share our reflections with our friends and compassionate superiors, then we are missing a great learning opportunity. What we should understand is that we all reflect as a normal part of everyday life. Reflecting is not limited to sitting down at a computer and typing something into our portfolio. In fact, we are reflecting constantly, asking ourselves, is there something better we can do, acknowledging our emotions, and even talking to our colleagues about things. A lot of doctors forget that the simple act of talking about a case at the end of the day is in fact reflecting. Reflecting is an incredibly helpful and a healthy part of life as a doctor. It is as important skill to develop from an early stage. Let me share two cases where reflecting helped me in difficult situations. The first was a patient on whom I had operated on just as I became a consultant. I was called to ED to assess a 50-year-old woman who had presented with excruciating back pain on a background of previous breast cancer. Investigations revealed that she had a metastatic lesion in her spine. After a team decision and multiple discussions with the patient, we decided to take her to theatre for stabilization of the spine. The worry was obviously that surgery may not work. However, since we felt that her cancer was not too far spread, we decided to take her to theatre to see if we could improve her symptoms and quality of life for her remaining years. Sadly, within a short period following the procedure, her disease spread rapidly and she passed away much sooner than we or the oncologists had expected. I was shocked at how soon she had passed. Was it the surgery or was it our care? I know medically that wasn't the case, but you will have such questions about your own medical care at times. In addition, I was concerned that we had inflicted more pain through the surgical procedure in the last few weeks of her life. It was through extensive reflection that I was able to come to terms with what had happened. At the time of presentation, operating on her was the best thing to do. It was in her interest to improve her quality of life, and it was a decision made with a whole team of doctors. Her case has stayed with me for many years, and whilst I am sad that she passed away, I am so grateful for what she has taught me about myself as a doctor. Her case emphasized that as doctors, we must appreciate the limits of our knowledge. I wasn't to know she would pass away so soon, and all we can do is treat the patient in front of us and ensure we are doing what is kindest for them at that time. The second case was when I was placed under investigation many years ago. An orthopedic case had resulted in a complication which was to be expected, but a complaint caused the case to be elevated to a disciplinary body. It is a well-known fact that doctors of BAME origin are more often the target of such inquiries, and is also well known that such investigations can have a devastating effect on the doctor's mental health. Doctors, for the most part, want to bring good to those around them, and when mistakes happen, we are often our own harshest critics. In this investigation, there were times I felt I was treated unfairly and the report contained a lot of factual errors. At the time, I remember feeling very let down by the system. To receive a report which was so biased against me and then to be asked to accept it felt like such an insult. I was convinced, however, that I was wanted to move forward. I had to accept what they had said. I went for retraining and it felt humiliating at that time. However, after the retraining, the case closed with no long-term implications for me and I could practice to my full capacity as before, for which I am very grateful. Accepting a wrong report does not seem right, but it was the kindest thing I could do for my family and my own cardiac and mental health. Many years have passed since that incident, and I know that I have spent many hours reflecting, which has helped me process that part of my career. In your medical career, both good and bad things will happen to you. Some things may make you feel hurt. Some cases will upset you, and there may be a whole phases in your career that stick with you for years to come. You will reflect on them every single day. Being able to be open and vulnerable to how these situations may make you feel will inherently shape you into a kind, compassionate doctor and change the way you practice on a daily basis. Don't be scared to reflect. Good things will come out of it. Thank you.